Hi, how are you? Okay. When did that start? Okay. Have you been swimming at all, or have you gotten any water in your ears, say in the shower? Okay. How about, have you had any ear pain with that? Any runny nose, sore throat? And how about any sinus pressure? Okay. Do you use Q-tips at all? And any history of hypertension, elevated blood pressure? Okay. How about family history? Okay. Mom said, okay. Okay. Have you had any kind of elevated temperature, any fever symptoms such as chills, night sweats? Okay. And just looking at what medications are on here. Just wanted to get a good picture before we begin from what you wrote down. Okay. Well, we're going to do a pretty comprehensive exam of your ears, and we'll also do some testing with your hearing as well, okay? And then, depending on what we're able to find in this exam, I'll make some decisions about how to treat you, whether or not we need to order imaging, or whether or not I need to refer you to a specialist so that way we can build a team to work together to figure out what's going on, okay? Okay. First thing really quickly is I just want to take your temperature, alright? So this is just going to hover over your forehead like so. Okay, temperature is in normal range. Okay. Sometimes when you have a newer box of gloves, these get really squished together, and when you try to just pull out one, they all want to come. But we managed. Okay. So the first thing I want to do once I get this glove on my hand is, okay, I'd like to turn your head side to side, and while I'm doing this, I'm going to be watching your eyes, looking for a certain kind of flickering that we call nystagmus, okay? If at any point you start feeling unbalanced or you start feeling kind of dizzy, I want you to let me know, okay? Okay. So, is it okay if I touch you? Thank you. So we're just going to go slow. And it's going to be some intense eye contact because I need to see if there's any flickering. Okay, you can relax for a moment. How do you feel? Okay, so you don't feel any kind of dizziness? Okay, I'm gonna try that one more time, if that's okay. Thank you. So, I'm gonna start turning your head to the right. Excuse me, I think I just swallowed some air. Okay, and then back to me. And how are you feeling after that one? That's one of the tests we do to check and see if there's fluid in the ear. So that test was negative. Okay. So then I'm going to grab my ear thermometer here. And I've got an old cover on. Okay. Did not expect that to go shooting across the room. Put a new one on here. So, okay. We're going to use this to scan the different areas of the ear, looking for any hot spots, okay? So, let me just turn off the volume here so it's not making a constant beep in your ear because people find that a little irritating. So, first we're going to start by just placing this in your ear here. Okay. And then I'm going to check the other side. Now I'm gonna check the temperature of the sort of cartilage nook in between the area we call your conch and your rook, your upper ear. Check the other side as well now. do one more check behind the ears. Kind of pulling your ear forward a little. Okay. So we'll try. There we go. Not seeing any hot spots on the ears. Now we're going to take a look inside. I'm also going to be using my insufflator bulb here to blow a little puff in each ear. Probably do a few puffs actually. What that's going to do is push air against your tympanic membrane, your eardrum, and allows me to see the mobility, which basically, if the eardrum moves or vibrates in accordance to the puff of air, or if it doesn't move at all, that can indicate that there's some fluid behind it. Alright? It shouldn't be painful. It might feel a little bit on the tickly side, but it shouldn't hurt. If you do feel any pain, let me know. Okay. How is that? Is there any discomfort or tenderness? Okay, good. Right off the bat, I'm not seeing any kind of redness or mobility on that side too. So then what I'd like to do is a quick clean of ears, both internally and externally. We're not going to remove all of the wax. Just a little bit, so that way I'm able to really get a clear picture of what's going on. I'm also going to clean the exterior portions of the ears because sometimes we may have some sort of skin infection or something going on that can contribute to that sort of feeling of irritation and pressure that you're experiencing, okay? Okay. Just gonna use some gauze here and start with this side. we got the external ears. Put that in there. Clean this off in case we need it again. Grab my instrument there. Alright. I'm just gonna go into the internal ear really quickly here and just do a little sweep through. Okay. That should be enough. So the reason why we went ahead and did that cleaning is because I'm going to be taking a look inside of your ears with my little camera here called a tympanoscope. And this way I can have a clear view of your eardrum. So just turn it on. Okay. And just need to make sure my computer here. There we go. Now it's connected. Okay. So this is just going to go in your ear very lightly. This is okay. Okay. This is Does this side, okay. Looking at my screen here. So that redness is extending back to behind your eardrum. I'm not seeing any kind of fluid, but that doesn't mean that there isn't any fluid present. Take a look really quickly into your throat. See if there's any redness or drainage visible. Can you just open for me? Thank you. Okay, so there is a slight bit of redness back there. I don't see any active drainage, but redness can be an indicator of there being drainage present. So, just a moment here. Okay. I'm gonna do a few hearing tests here, okay? So, just a moment because I need to get my program started. Alright. Just going to take these headphones and place them over your ears. They are noise isolating, so outside sounds should be a bit muffled. But in just a moment, you should hear a beep. I want you to raise your hand according to the side that you hear the beep on, okay? Okay. So, We've got a few seconds here. Okay, should be starting. Should be all of them. Yep. Go ahead and remove these. Okay. So you did get all of those correct. So now I'm going to do a different hearing test. This one will involve me whispering a number into your ears, and I want you to repeat to me what you heard, okay? Okay. So, start on this side. 63. 27. Good. 42. 98. 12. 6. 42. Yes. And 73. Okay, good. So we got all of those correct. Okay. I'm gonna do one more hearing test. This one involving a tuning fork. And for this one, I would like for you to close your eyes if that's okay. Okay. So, the way this is gonna work, and actually to do this, I'm going to remove my gloves. Boop. Okay. the way this is going to work is I'm going to be moving the tuning fork around, and just like with the beep test, I want you to raise your hand according to where you hear it, okay? So it may come in and out of one side. When it gets close, I want you to raise. If it goes away, lower, comes back, raise. Switch to the other side, okay? It's a little more complicated, yeah. But it does help me to gauge if you're able to sense proximity with sound. Okay, you ready? Close your eyes. You can open your eyes. So it does appear that whatever is going on is not affecting your hearing, so that's good. I do suspect that there is an ear infection of the inner ear, and that's what's causing the pressure and discomfort. So I'd like to confirm that by ordering some imaging here. So just get an order out. Okay. So I'm gonna do a CT of your ears and sinuses. And I'm just checking to see. Any medication allergies here? Okay. seeing anything. So for now, I am going to have a medical assistant call in a prescription for some eardrops. Not going to write anything for an antibiotic yet. I want to see what the scans show, and if it does look like there is an infection, then we will proceed. But I don't want to give you antibiotics if you don't need them. So just gonna do some eardrops here. Just some eardrops. You're going to use one drop in each ear twice a day, okay? I wrote for an entire bottle, but let's start with using it for 2 weeks. And then if we determine that we need to add an antibiotic after I see the scans, we'll do that, okay? Okay. I did write an order for you to stay while the radiologist is reading the scans, so that way I'm able to see them while you're still here, talk to the radiologist, and then we'll get the next step in place for you. If it doesn't look like anything is an infectious process, then we're not going to worry about any antibiotics. But if it is, then I want to make sure that you get everything you need today, okay? Do you have any questions for me? Yeah, radiology is just downstairs from our office. If you go out the main door, you're going to see a sign that has a directory basically, and it'll tell you which room number to find the imaging place. Yeah, and one of the front desk girls can help and direct you as well. I'm sure somebody could probably even walk you down there if you'd like. Well, it was really nice to meet you, and we'll get in touch in just a little while.